In the studio is a doctor, that's a public health physician. We'd like to thank you for joining us at this time, Dr. Ogunyemi. Thank you so much.
Thank you for having me.
All right. Now, looking at everything, that situation in Benin City, does that give you cause to worry?
Yes, because even though we're doing well in Lagos, it's still a global issue. So whatever affects Benin City, definitely, at the end of the day, will cascade down to Lagos as well. So yes, it gives a cause for concern. And I think that they should look into how Lagos State has been doing it, what measures we have put in place on Lagos, how we have to an extent been able to go ahead with the lockdown in Lagos. Because driving through the streets of Ikeja this morning, it was like a ghost town. You could barely see people around. There were no downfall buses, no commuters, very few people on the road. You have security personnel at virtually every checkpoint, asking you who you are, where you're going. So yes, in Lagos, I think it's working, and they might want to take a cue from that in Benin.
Looking at perhaps other things that they could be doing and what some other state governments are doing, including the federal government, decontamination, disinfecting marketplaces, public places, and homes as well. Do you think that there is any maybe major impact that this has with regards to preventing the spread of COVID-19?
Oh, yes. Oh, yes. Now, you have to look into what other countries have done as well. If you look at China, you see quite a number of videos being shown of how China is decontaminating the environment. I think that's one of the reasons why China so far has been able to an extent, curtail the spread of coronavirus in China. If you look at China, they're doing quite well now, despite the fact that the virus started up from China. Now, the decontamination issue is very helpful. I don't know if you saw this record, something on, I think, a sheep, that after about 14 days, they still found, the virus on shelves and stuff like that. So that means there's a possibility of the virus surviving for a while outside the human body. Research is still going on. There's still so many things we don't know about the virus. So if decontamination would help, I think we should go ahead and do it.
All right, let's quickly go to our correspondent who hears live for us in Kano, Idris Jibrin, to give us an update on the compliance levels there. Idris, is there our correspondent there in Kano talking about the palliatives coming in from the state governments, and this is also going across. Some people are saying this is not sufficient, but if you heard the respondents there at the New Lagos Benin market, they were saying they need to go out to fend and feed themselves, but they then also have to social distance. So are we between a rock and a hard place, or what should be priority for families in this period?
That's a tough one, because when you're hungry, the only thing you think about is food. You're a mother with children, your children are home, they're hungry. The only thing you think about is how to get food for them. Your health will come secondary. I think what needs to be done is that the idea that came up of opening the markets between certain hours of the day should help, because what is being provided really, really, really cannot be enough, to be quite candid. If you look at the estimate for Lagos State when it comes to population, we have an estimate of, let's say, 35 million for 2020. Now, if you break that down into the 57 local governments, local council development areas, you break it down to the ward level, you break it down to the street level. How do you want to cater for all these people? You might be able to cater for some, but will it really be sufficient? So at the end of the day, the government needs to sit down and be able to decide how to go about this effectively. Because if people are hungry, they're going to go out. They won't stay indoors. And in Nigeria, we have this mentality, sorry to say, that it's not going to happen to me, which is not a very ideal mindset at the end of the day. So my advice is that even though we're still on lockdown, we're trying to prevent, the spread of the disease via social distancing. To an extent, we must be able to provide food for people at the community level, so that at least people don't have to go too far to get basic things to eat.
All right. We'd like to appreciate your time, public health physician, Dr. Ogunyemi. Thank you for joining us on the program.
Thank you so much, and well done to Channels. You're doing a great job.
Thank you.